Before the pandemic, Governor Cooper declared there was a deadly epidemic of opioid use. Like many pre-pandemic problems, it kind of fell out of the spotlight, but the drug use kept getting worse. Each Monday this week, we are looking into what happened to the big news stories before the pandemic. 2 Wants to Know's Ben Briscoe answers the question for opioids.
At UNCG, Scott Lomagistro is the type of success story that inspires. Today, he's close to graduating with a degree in psychology. But 3 years ago,
unfortunately for me, it took losing just about everything before I was really willing to do the work.
He was homeless and eating out of trash cans, hooked on heroin. Scott's family helped him get into treatment right before coronavirus hit. Through the pandemic, he stayed clean by using Zoom meetings and talking on the phone with close friends. Options not all addicts could access.
As of now, I've lost 6 friends this past year, and the last friend was 2 days ago, who had multiple years in recovery and succumbed to an overdose. Their passing was a result of isolation and that inability to contact individuals in their support network when necessary.
During the pandemic, overdoses rose across the triad. In Guilford County, overdoses went from 910 in 2019 to 1,074 in 2021 as of October. In Forsyth, 847 in 2019 compared to 1,002 so far in 2021. The Forsyth County Health Department says the isolation part of the pandemic hurt a lot of addicts, but also
a lot of people lost their jobs or struggled with employment. A lot of people are grieving. They may have lost a loved one. All of those things just kind of created the perfect storm.
Even people who don't use drugs are impacted. Experts say the increase in opioid use has a lot to do with those help wanted signs all over town.
Either they can't get hired to get a job because of it, or they're not working because of health problems related to it, or mental health issues related to it. So it's something that in lots of little ways can affect us in ways that we don't even think about.
The good news, North Carolina is supposed to get about $750 million in settlement money from lawsuits over the way drug companies marketed opioids.
That this can be a long-term investment in the infrastructure.
Elise Powell is the state opioid coordinator for the Department of Health and Human Services. She says that money will go to support a plan of prevention and treatment programs developed before the pandemic. One that started to help things get better before coronavirus.
I am hopeful, maybe that's just because I'm an internal optimist, but we, like I said, right before the pandemic, we were starting to see a turn of the tide. Other states and countries have achieved this. And so I think that it's absolutely well within our reach. We just have to invest in what we know works.
She also knows coronavirus forever changed the opioid epidemic.
Some of the changes that have happened have been positive. So for example, the federal government repealed or temporarily suspended a ban on providing medication-assisted treatment via telehealth. That's a huge boon for helping people who don't have access in their own community to access evidence-based care, right? And so what we want to do is really take the lessons learned from the pandemic and use those lessons learned and those new tools and flexibilities to see how we can do better.
Scott hopes all of the talk about mental health during the pandemic will start to take away some of the stigma of substance abuse.
If somebody is ill with cancer or diabetes, they're treated after a diagnosis. There is no true stigma attached to it. But when you have somebody who's dealing with substance use disorder, there's this idea that somehow that individual is dealing with moral failing.
He's going to keep sharing his journey to help change that opinion. After graduation, Scott plans to use his degree to help more addicts write their own recovery stories.
Well, that settlement money could start rolling out in April. Before that, counties must sign on and agree how the cash will be used. If they don't, they won't get a portion of that money. So far, every county in the Triad has signed on except Stokes. Commissioners there say they are working on it and intend to meet that deadline.